أهلا فيكم مرة ثانية بالجلسة الثانية للمؤتمر اليوم. مثل ما شايف بعد عنا مشاركين من جامعات متعددة، من هيئات حكومية متعددة. مثل ما قلت بالصباح عم نخلط التقديم بين العربي والإنجليزي لأنه عنا مشاركين باللغتين. بالجلسة هيدي معظم المشاركين عربي، فإذا بدكم تحكوا شوي عربي فيكم. بالافتتاح والجلسة الأولى حكينا إنجليزي أكثر لأنه كان عندنا كثير مشاركين من يوروب خاصة ومن دول آسيوية اللي ما بيعرفوا يحكوا عربي. الجلسة الثانية عن نوعية الهواء وتغير المناخ. So our second session in this conference is about climate change and air quality, and the representatives or the authors of the two chapters on air and climate change will present their findings. So I stop here. Dr. Farid Shaaban, professor of electrical engineering at AUB and researcher on air quality also, will moderate this session. So the floor is yours, Dr. Farid.
Thank you, Najib. Good morning. First, I would like to start the session by thanking AFID through Mr. Najib Saab, through His Excellency Dr. Badran, Sharbil, and all the team for organizing this conference. Also to thank the AUB team through Dr. Rima Habib for all their efforts. I am glad to welcome on the panel the pronounced experts, Dr. Jihan Hassan from AUC, Dr. Rand Ahmedi from Arabian Gulf University, and Dr. Hassan Daini also from AUB. Before I leave the floor to the speakers, just give me 1 minute to provide a short correlation between COVID-19 and air pollution. Although COVID-19 is the main concern at global scale these days, but let us not forget the mortality numbers associated with air pollution. These are far exceeding the amount of deaths and tragedies from COVID-19. And these numbers are estimated annually at around 7 million people losing their lives due to air pollution or for reasons associated with air pollution. Another correlation between COVID-19 and air pollution, and based on recent reports published in EU and USA and other countries, they stressed that poor air quality make people at greater risk of contracting the virus and suffering serious illnesses and even death. And to give some numbers, a Harvard study recently has found out that a small increase in the concentration of PM 2.5, particulates 2.5, of concentration, an increase of 1 microgram per cubic meter is associated with an 8% increase in the COVID-19 death rate. And these are really alarming figures. So just a final concluding statement: as the world suffers through the respiratory COVID-19 pandemic, the need to breathe clean air has never been more crucial and more apparent. I would like to welcome as our first speaker, Dr. Jihan Hassan. Dr. Hassan is an adjunct professor at the School of Sciences and Engineering at AUC. She advises governments, private sector companies, and NGOs, and is the manager of the Environmental Services Unit at Chemonix Egypt Consulting. Dr. Hassan holds a PhD in environmental engineering from the University of Cambridge. She has over 12 years of professional experience in construction management, environmental engineering, and sustainable development. Dr. Hassan is the author of various specialized publications. Dr. Hassan, you are welcome, and the floor is yours.
Thank you. Good morning, ladies and gentlemen. It's my pleasure to be here with everyone today. I'm going to be discussing the impacts of climate change on human health, Chapter 7 of this year's AFET publication, on behalf of my colleagues as a co-author of the chapter. I will start out with a brief introduction, followed by the global effects of climate change on health, both direct and indirect. I'll touch upon this in the Arab region, and I won't go into too much detail since the following session will be addressing this in more detail by Professor Hamadea. I will talk about current strategies, both adaptation and mitigation strategies globally and in the Arab world, and I'll finalize with some conclusions. I'd like to say that this isn't the first time for AFET to discuss climate change and human health. In 2009, in the AFET annual publication, this was addressed, and this chapter here presents an update for this chapter, and we'll go into a bit more details. It will be remiss of me to discuss this without going back and addressing the Sustainability Development Goals, or SDG 2030 agenda, since both climate change and human health are considered two of the greatest challenges facing the SDGs. And I've heard many refer to them earlier today. I'll talk about SDG 13, which calls for taking urgent action to combat climate change and its impacts, which have both environmental health impacts as well as human health impacts. And we'll go into a bit more detail in that. I'd by discussing the global milestones on climate change and human health. And since 1992, the UN Framework Convention on Climate Change stated that climate change adversely affects human health, and that countries are committed to assess the effect of adaptation and mitigation policies on health. I'd also like to highlight two particular milestones. In 2015, the Paris Agreement at the 21st Conference of the Parties, or COP21, which not only addressed decreasing or keeping global warming potential below 2 degrees, it also addressed the right to health, that it should be central to the actions that countries take. The agreement commits countries to implement adaptation plans to protect human health from the worst impacts of climate change. In 2018, at the COP24, they issued a special report on health and climate change, highlighting the interconnection between the two and presenting an overview of the tools and initiatives that can be used by the international public health, the implementation of the Paris Agreement. As it can be seen, this association between climate change and health is quite intricate, complex, and multifaceted, with many factors involved. These factors are reflected in the literature, and if you like, they've been divided or categorized as both direct and indirect, to have a direct and indirect impact on health. If you see this figure in front of you, central to the figure in the blue color, you find the direct impacts, which include extreme weather events, rising temperatures, sea level rise, and air quality. Air quality in particular is sometimes considered a direct and sometimes considered an indirect impact. And extreme weather events, for example, can change local communities into environmental refugees. Increasing global average temperature are linked to non-communicable disease morbidities, cardiovascular diseases, and facilitates the formation and dispersion of certain types of air pollutants. If you look at the brown circle surrounding this, this represents the indirect impacts of climate change. And here I'd like to discuss a couple. So let's say, for example, water and food security. In various ways, extreme weather conditions, sea level rise, and increased temperatures lead to reduced crop yields, damaged crop, loss of farmlands and livestock, increasing food prices. Also, warmer oceans and seas lead to reduced yields from fisheries as fish move to higher latitudes for cooler water. Also, social disruption and population displacement often happen as a result of extreme weather events such as wildfires, droughts, floods, which all can lead to loss in farming jobs in general, land, infrastructure, housing, and can cause rising conflicts over scarce resources. Human health is consequently affected due to the reduced access to health service, increasing vulnerability to infectious disease, and increasing mental illnesses. It's very important to note that both direct and indirect impacts of climate change on human health are mediated by other factors such as environmental, geographical, ecological, and social factors. These effects can be short-term, short-lived, or long-term, and often with lifelong consequences for health, such as mental illnesses after extreme weather events, climate-related displacements, and loss of culture. And it's very important for us to be able to understand these factors in order to be able to design efficient and effective strategies to combat this. I won't go into too much detail about these effects in the Arab world because, as I said, they will be discussed in the following session. But the literature indicates that climate change has already imposed a health burden in the Arab region, and that very few Arab countries have identified vulnerable populations like children and the elderly. And it's not currently being given adequate attention by stakeholders and researchers. And there's a huge variability in the information that's being provided by various countries in the region. Now I'd like to talk about the global both adaptation and mitigation strategies, and I'll start by adaptation. Here, the strategies can be categorized based on the climate change health risks, such as the thermal stress, air quality, vector-borne diseases, waterborne diseases, which you can see on the left column. They also can be categorized based on the tools that are used, such as legislative, technical, educational, or cultural and behavioral. So let's take an example. Let's say air quality. In terms of legislative, there are emission controls, traffic restrictions. In terms of technical, we can have improved public transport, catalytic converters in vehicles, or smokestacks for industry. Educational, we'll have pollution warnings, and cultural or behavioral would include carpooling or walking more, using cycling and things of that sort. Now, in the Arab region, there seems to be a lack of adaptation strategies targeting the health sector. However, some countries have implemented local and national health-related adaptation measures. For example, Egypt implemented actions to build institutional and technical capacities to work on climate change and health, and have identified opportunities for further action and climate change adaptation, such as integrated surveillance and response system or building a climate-resilient infrastructure. In Jordan, now Jordan is ranked among the poorest countries in the world in terms of water availability, and so they had a climate change adaptation to protect human health project, and this was aimed to increase adaptive capacity responding to health risks resulting from water scarcity. In Tunisia, they undertook an intersectorial assessment of vulnerability and adaptation to climate change, which resulted in the development of an adaptation strategy. When we talk about mitigation strategies, it's very important to realize that these strategies, unlike adaptation strategies, operate on a more local adaptation strategies operate on a more local and contextualized level and tailored to different objectives, whereas mitigation strategies are often initiated as response to commitments to the UNFCCC and the Paris Agreement through nationally determined contributions, with the sole objective of decreasing greenhouse gas emissions. While adaptation is mostly driven by direct health risks, mitigation measures and policies are driven by economic cost and energy implications. And as a result, here we're presenting general mitigation measures that have been adopted worldwide and their health co-benefits. So if we take an example from the table in front of you, if we look at well-planned urban public transport policies encourage the use of public transport, walking and cycling, these would have the health co-benefits of increased physical activity, reduced obesity, reduced traffic injury and death, reduced noise, and reduced air pollution-related mortality. In the Arab world, almost all Arab countries have signed and ratified the 1992 UNFCCC and its extension treaty, the Kyoto Protocol. And there have been various initiatives in the region. So again, I'll take an example from the table in front of you. If we look at the International Solar Alliance, which mobilizes more than $1 trillion of investment by 2030 for the massive deployment of affordable solar energy, you can see that Algeria, Comoros, Egypt, Mauritania, Oman, Saudi Arabia, Somalia, Sudan, and the United Arab Emirates have taken part in these initiatives. I'd like to very briefly summarize what I've said. So the literature indicates that climate change has already imposed a huge health burden both globally and in the Arab world. When you look at climate change adaptation, there are many global initiatives and programs that are being done. However, in the Arab world, there seems to be a lack of regional adaptation strategies, and in many Arab countries, there's a need for national adaptation plans. With regards to mitigation policies, again, these are driven primarily by economic costs and energy implications. However, the long-term benefit is quite significant. In the Arab world, more needs to be done, especially with regards to policy on climate change mitigation measures. I'd like to say that finally, human health, animal health, and environmental health are all linked, and that human health cannot be protected unless animal health and environmental health are also addressed, which is, I think, been made clear through these presentations and various others. This One Health perspective is very relevant to global challenges such as climate change, since it affects the environment in which humans and animals live. And even though there isn't a direct relationship between climate change and COVID-19, which has also been a topic of conversation today, it is clear that climate change may have an indirect effect on zoonotic diseases in general, which includes COVID, in addition to Ebola, bird flu, and swine flu. I'd like to leave you with this quote by the former United Nations Secretary General Ban Ki-moon, who said that climate change is intrinsically linked to public health, food and water security, migration, peace and security. It is a moral issue. It is an issue of social justice, human rights and fundamental ethics. We have a profound responsibility to the fragile web of life on this earth and to this generation and those that will follow. Thank you very much, and I'm ready for your questions.
Thank you, Dr. Hassan. Thank you for the informative presentation. I guess as Mr. Saab instructed, we will leave all the questions till the end of the session. Thank you. Our next speaker is Dr. Randa Ahmadi. Dr. Ahmadi is a professor and former Vice Dean of Graduate Studies and Research at the College of Medicine and Medical Sciences and professor in the Department of Family and Community Medicine in the Arabian Gulf University in Bahrain. Dr. Ahmadi has over 120 publications in peer-reviewed scientific journals in several fields, notably smoking, non-communicable diseases, and disease burden. She is a member of various regional and global advisory committees and has worked on the Bahrain National Communication on Climate Change. Dr. Ahmadi is the commissioner of the Lancet Neurology Journal to study strokes in low and middle income countries. Dr. Ahmadi, you are welcome. The floor is yours.
Thank you very much for the introduction, Dr. Farid. I would like to start by thanking Dr. Najib for bringing me on board with all of you when he came to Bahrain just before COVID-19 started, and he convinced me to join the group. It is really it is a pleasure for me to be with the group for many reasons. First, I'm also with my AUB Faculty of Health Sciences, where I graduated from, people and family. And I'm seeing others who have been, I haven't seen, at least virtually. The other thing is I'm very thankful to the opportunity to have worked with the group on the chapter. And it is really one of the unique times where everything was so smooth, and we were very, so all the co-authors were great, and we were very, I think we were, we don't know, I don't know any of them, but now we know each other. Back to what I want to talk about is I did not prepare slides because Dr. Gihan has already given a very comprehensive outline of the chapter, but I want to just comment on certain things which are relevant to the Arab region. We know, first, Dr. Gihan, you did a great job even representing my part, which is summarizing it. Now, we know that the Eastern Mediterranean region is reported to be the second region which is vulnerable to heat exposure after Europe. And extreme weather and climate action failure are ranked among the 5 risks by likelihood and impact globally. However, our countries did not, the respondents of the Global Risks Survey did not risk perception survey did not rate them among the 5. So there is this understanding that an underestimation of the problem. The region faces several challenges to climate change with respect to morbidity and mortality, and of course DALIs have not been touched upon in several literatures which I have encountered. I want to also comment on the data sources that I have used in writing the part of the chapter. I found that the first one that I looked at it is the United Nations Framework Convention on Climate. And to my surprise, I found only a few national communications submitted have included health. And those that have included health, there is variation in the amount of, or the capacity that they have allowed to include about health in the report. The projections also were much fewer when we talk about what are the projections. We have Egypt, Jordan, Lebanon, Morocco, Oman, and some other countries have included these projections. Now, if you go to their website, you find that some countries are still at the cycle 1, which they have submitted, like Iraq has, in 2015, has submitted the first report, while Jordan has submitted report 3 in 2014, and Bahrain has submitted the third cycle in 2020. So there is really a great variation in that. With respect to the publications that this study the association between climate change and health, it is really, I felt a bit sad that there aren't many papers that look into the Arab region, several countries together, except for a paper which was written by Professor Habib and another by Dr. Khader, and of course the AFID report in 2009, which is a book. There is variation in the countries with respect to the research output of climate change and health publications. And there is lack of studies in several countries that you hardly can find anything to write about. Now, coming to the literature, of course, Dr. Gihan has mentioned that there are direct effects and indirect effects. And here the most direct effects that hit the region are temperature, heat waves, sandstorms, droughts, and flooding. Looking at the mortality, all causes mortality from all causes, we find that few studies have examined the association of climate change and mortality, and they have indicated that rises in temperature are associated with more increased premature mortality. And these studies came from Egypt, Tunisia, UAE, and Lebanon. However, in Bahrain, an ecological study has been done and showed that humidity was the one that was associated with, temperature was negatively associated. Now, the region faces a lot of flooding and rain and heavy rain, and there are a lot of fatalities due to that. So some countries in the region have experienced flooding in the last decade, and there's so many out of the Arab countries have faced that. In the region, Saudi Arabia continuously faces that, particularly Jeddah. No, so fatalities due to heavy rains and flooding, and then we have fatalities due to dust storms and low visibility. So there are these are several. One study from Kuwait. We don't have many studies. We don't have any studies showed that when fatalities, when there are storms, when we have a lot of sandstorms and low visibility, cause higher fatalities. Now there is also literature on mortality from specific causes, mainly CVDs, asthma, and other respiratory diseases, non-accidental injuries, RTAs, and dengue fever. Now, you can find just little from here and there to write about, but sometimes you have only 1 or 2 countries to represent. It makes the it is difficult. About RTAs, not many are writing about RTAs, and humidity, for example, in the study that has been conducted in Bahrain, it was positively correlated with humidity, the RTAs in Bahrain. Now, with respect to morbidity, morbidity, the Arab region is a hotspot for emerging and re-emerging communicable diseases, and climate change is one of these contributors. It increases waterborne diseases, foodborne diseases, vector-borne diseases in our region. So some of the diseases that have been listed or as related to climate change, cholera and waterborne diseases, we had outbreaks of cholera that have been during the last decade in Somalia, Iraq, and Yemen, and they were associated with high temperature. We have foodborne diseases. We know that the GCC countries have high temperatures in the summer, and there is a risk. There were reports of outbreaks. Particularly, there was one from Dubai and Kingdom of Saudi Arabia, and we know that also in Bahrain we have about 6.9% or about 7% of the notifiable diseases were associated with humidity from foodborne diseases. The vector-borne diseases, malaria is endemic in our region, in Djibouti, Somalia, Sudan, Yemen, and however there are increases in cases that have been attributed to heavy rain and temperature and relative humidity. Now, there are scanty reports about tuberculosis and scabies from Morocco and Algeria. Going to non-communicable diseases, temperature has been shown to be affecting cardiovascular disease visits, in increasing the cardiovascular disease visits in the UAE. And in Bahrain, it has been shown that hospital discharges were associated with humidity for CVDs. Ischemic heart disease, again, there is a report from Syria that it is related to temperature. Bahrain, it is also related to humidity. Most of the data from Bahrain show the humidity as a factor. Now, Kuwait has shown that dust and sandstorms have affected the admissions in Kuwait and of COPD and asthma. And the literature is not rich enough for, we have just little few papers that are mentioning dust and sandstorms. And I felt really very sad that we are an area that has dust and sandstorms. And I know we had so many appeals for doing studies on dust and sandstorms, and yet we don't have, and health, and we don't have, this is really a weakness in our research. Heat cramps and dehydration, also increase in temperature. Kuwait and the UAE have shown that there is an association with temperature, while UAE with humidity. Again, morbidity, RTAs in Bahrain were associated, an ecological study showed that it is associated with humidity and mental illness as well. And we know also there is drought in some countries of the region, like in African countries like Djibouti, Mauritania, Somalia, and South Sudan, and the Sudan in the last decade, and have affected undernutrition and food insecurity. Coming to vulnerable population, our region, particularly the Gulf, we have the construction workers are at higher risk. Definitely those who are outdoor are at higher risk, but we are at higher risk because of the temperatures that we encounter in the summer. So there were some studies in Bahrain that looked into that, and the UAE. So we have construction workers and outdoor workers, we have children. And these children, a study from the UAE showed that children in the summer months, school children have more migraines and asthma admissions during standard storms in Kuwait among children, and diarrheal diseases in the summer. So, and the last group is the elderly. Not much has been done on the elderly in our region. And I mean, with respect to what we're talking about. Now, projections. We have very few countries, not all the countries, have made their projections, and in the chapter you will find the projections. But in general, we know that malaria is going to increase, particularly in Sudan, Oman, and Morocco, and leishmaniasis, waterborne diseases, and there will be re-emergence of some diseases like malaria in Tunisia, and schistosomiasis in Tunisia as well. There will be an increase in NCDs, increase in allergic and pulmonary diseases due to increase in sandstorms. The overall mortality or all causes mortality would increase, CVDs, strokes, respiratory diseases, infectious diseases, and fatalities from flooding and droughts. So mortality it is speculated also that mortality among the elderly from heat leading to strokes and heart attacks would also increase, and fatalities due to flooding and drought. I'd like to conclude by saying that the impact of climate change on health is not given adequate attention. That's the least to say by stakeholders and researchers in the region. There is really an urgent need to address the knowledge gaps and have support from health policymakers. There is a lot of need to ask researchers to collaborate across the Arab world to do multi-center studies and to إثراء publications in the region. Thank you very much.
Thank you, Dr. Hamadi. Your timing and the timing of Dr. Jehan are really perfect. Just in time. Thank you. Our next speaker is Dr. Hassan Dheini. Dr. Dheini is an expert in toxicology and health risk assessment with more than 18 years of experience. He has served as a consultant for local authorities, private firms, and international agencies, and is currently an assistant professor at AUB. He holds a PhD in toxicology from University of Michigan, Ann Arbor. Dr. Dheini, the floor is yours.
Thank you, Dr. شعبان. بتشكر المنظمين اللي دعوني لأشارك بصياغة التقرير، تقرير المنتدى العربي للبيئة والتنمية 2020 والمشاركة بالمؤتمر 13 نيابة عن حالي وعن زميلي وصديقي my co-author بصياغة التقرير دكتور شرب العفيف من الجامعة اليسوعية. Air pollution perhaps is one of the world's most challenging environmental and health problems. And actually it was recognized as a pressing challenge, clearly figuring in at least 2 SDGs to complement what Dr. Habib has presented. Normally air pollutants, we look at them in 2 categories. What we call the criteria air pollutants or the CAPs. which are actually the main determinants of the air that we breathe, the air quality, and the hazardous air pollutants, or what we also call the HAPs, which normally include the air toxics. And actually, many of the pollutants can be caused by natural processes, such as dust and sandstorms in GCC countries, مثل ما قالت Dr. Randa, and also sea spray in coastal areas, as in the case of Lebanon. But most importantly, air pollution is due to human activities from mobile sources such as traffic or point sources such as the stack of a factory or a power plant or an area source such as a landfill. ونحن بلبنان we have many, or a volume source such as a highway or a conveyor. And this is actually only outdoors. Indoors also we have many sources that could impact air quality, particularly the combustion activities indoors, like cooking or heating, a cooling system, humidification devices, tobacco smoking, the building construction material, the furniture, and many chemicals that are used as part of the household. Now, the reports from the Arab world are actually alarming because they show a trend of increase in air pollution levels. And this is mainly attributed to rapid urbanization and economic growth. And in many parts where studies have been done all over the MENA region, studies show that the emissions of air pollutants have increased by up to 5-fold in certain areas in the past 3 decades. And this is mainly attributed to the energy sector and the transportation sector. According to the World Health Organization, the air quality indicators in the Arab countries often exceeds the guideline values. And now, so as part of the criteria air pollutants are the particulate matters, which are actually showing a trend that are in excess of the international standards. And this is based on reports by the WHO and the World Bank. The particulate matter 10, which is what we call the inhalable dust, which is normally the dust that comes from grinding and crushing and construction activities. If we compare the cutting point, the standard defined by WHO of 20 microgram per meter cube to the data coming from the Arab world in different Arab countries, we can see that there is an excess. It is in excess by 6 to 13 times. If we look at the data for PM 2.5, which is what we call the respirable dust, and this is the dust of the highest concern because this is the dust that actually enters our lungs, and it mostly comes from combustion activities. So if we compare the WHO standard of 10 microgram per meter cube to the levels in the different countries in UAE, Bahrain, Egypt, Iraq, Kuwait, Qatar, Saudi Arabia, again, we can see that it is in excess by 3 to 8 times. My slide is freezing, so. Okay, so again, in addition to the PM, there's actually a trend of increase over Arab urban centers for the other CAPs. So for instance, for SOx, which normally comes from fuel and power plant, normally there's an increase by 60 to 120%. And for NOx, which normally comes from traffic, and this is the pollutant responsible for the brown smog, there is also an increase by up to 12%, again, over urban centers in a report looking at data between 2005 and 2015. The levels are also high over oil ports and refineries and urban settlements in the GCC countries. And these actually increasing patterns that we're observing are actually attributed to fossil fuel addicted societies. and societies that are not really investing much in clean energy, the increase in population density, and the absence of eco-friendly public transportation systems in many Arab countries. Now, for hazardous air pollutants or the HAPs, we are also seeing trends of increase. For instance, for non-methane hydrocarbons, there is also an increase by up to 7% over Arab urban centers. In Beirut, for instance, there is actually an increase of non-methane hydrocarbons like benzene, for instance. And if you can see that it's much higher compared to larger metropolitan cities like Los Angeles and Paris. Now, the data from the indoor air pollution, based on the research studies that were conducted, are not much better, because they also show levels that are in excess of the WHO air quality guideline values for different air pollutants like PM2.5, NOx, volatile organic compounds, ozone, and other pollutants, and this is in different settings in different countries. Now, these levels are alarming because there is mounting evidence that indicates that this exposure is actually associated with an increased health risk. The ambient particulate matter are reported as the 5th leading risk for DALYs in Eastern Mediterranean region countries, one DALY being defined as the loss of the equivalent of 1 year of full health due to a disability or due to a premature death. If you look at the data on the left, the highest reported DALYs lost per 1,000 capita per year for indoor air pollution is in Yemen with 13 DALYs, followed by Sudan. And this is mainly because of the use of solid fuel indoors. If you look at the highest DALYs lost for outdoor air pollution, and we can see that it is highest in UAE and followed by Lebanon. But at the same time, you can see that there are many large data gaps for many other countries and a large underreporting as well. Now, more specifically, exposure to these excessive levels of air pollutants are associated with a higher mortality rate in many countries. And there are many reports for Egypt, Kuwait, Lebanon, UAE, and others. For instance, in UAE, the leading environmental contributor to mortality is ambient air pollution, making 7% of all death. Similarly, in the city of Beirut, in a study that we conducted earlier, tracking PM2.5, we found that it is associated with about 7 to 10% of all death in the city on a yearly basis. Air pollution is also associated with cardiopulmonary diseases in many Arab states, and of course globally, like COPD, ischemic heart disease, hypertension, and asthma, which prevalence is increasing. There is a recent report that shows a 42% increase in respiratory diseases in the EMR region over a period of 15 years. Air pollution is also associated with higher cancer risk, and this is reported for a certain number of Arab states. There is a certain shortage of data on that, but there are still few reports that report that. And this is important because the International Agency for Research on Cancer, the IARC, has actually classified outdoor air pollution as in group 1 with sufficient evidence that it causes lung cancer in humans. Among these reports, we have previously reported a 30 to 40-fold excessive cancer risk due to non-methane hydrocarbons in the city of Beirut. There's another Lebanese study that reported a 13% of total lung cancer cases in Lebanon to be due to particulate matter. 100-fold higher cancer risk due to heavy metals and PM10 in Jeddah in Saudi Arabia, and there are many other reports. Of course, air pollution causes other diseases as well, some of which have been mentioned by the presenters before me. Air pollution can also cause other effects. We actually recently found that air pollution can contribute to birth defect risk based on a large-scale nationwide study that we are currently conducting in Lebanon. As a conclusion, air pollution levels in the Arab world are showing increasing patterns and alarming patterns, especially in urban centers. The observed trends are mainly due to fossil fuel burning, to road transportation, which mostly relies on passenger cars rather than public transportation, industrial activities, and that particularly include the oil and the gas sector. And all of these are, of course, topped with natural sources that I already mentioned. The challenges that are currently facing the Arab world towards improving their air quality includes outdated regulations, lack of law enforcement, and absence of sustainable air quality monitoring networks. At the health level, the data from the past 25 to 30 years report an increase, a tremendous increase in cardiopulmonary diseases and in cancer incidence. However, at the same time, there is a lot of data gaps in many countries, and this precludes an accurate assessment of the health impact. So I'd like to conclude with recommendations. وهون بدي اختم التوصيات بالعربي. دكتور صعب سمح لنا نحكي عربي، صح احكي بلغتنا الام. اول شيء تحديث القوانين والمراثيم التنفيذيه لفرض اعتماد افضل التقنيات، يعني البست افيلبل تكنولوجيز للحد من الانبعاثات السامه. ثاني شيء تطبيق القانون بطريقه فعاله وتغريم المؤسسات والصناعات اللي غير ملتزمه. ورقم 3 هو استدامه وصيانه شبكات المراقبه. هون عم بحكي عن مراقبه نوعيه الهواء، يعني الاير كواليتي مونيتورنج نتوركس، ونحن عندنا معاناه خاصه بلبنان بهذا الموضوع. والنقطه الثانيه هي استدامه كمان تقارير المؤشرات الصحيه. رقم 4 هو انشاء وتحديث قوائم مصادر الانبعاثات، يعني الاميشن انفنتوريز، واستخدام نماذج عاليه الجوده بموضوع محاكاه تلوث الهواء، يعني الاير ديسبرشن موديلنج سيستمز اللي هن they should meet scientific performance criteria. رقم 5 one of the gaps اللي بدي اذكرها هو الموضوع ال concentration response functions اللي هن missing in many of our countries. وهون هذا على عاتق الوزارات المعنيه انه بكل دوله يكون عندنا concentration response functions derived حتى نقدر نحدد الاثار الصحيه كباحثين بشكل ادق. ورقم 6 هو وضع قوائم تحدد الاولويات لتقييم المخاطر الصحيه، كمان هون من قبل الجهات الحكوميه كاساس لاداره المخاطر. وشكرا.
Okay. شكرا دكتور دهيني. Thank you very much. We still have around 10 minutes before we start the general question and answer session. I have one question for all three speakers. رح بلش معك دكتور دهيني بما انه انت بعدك على البوديوم. شو هن المين challenges اللي يعني or obstacles facing the successful combating of climate change in Arab countries in general or in one or two countries that you select?
I think the main, I would say the main factor who outdated regulatory يعني regulations, rules and regulations and policies. لأنه بكتير محلات we are still using very old text in regulatory issues. يعني recently I've been involved in with this regulating the cement industry emissions in Lebanon. وشفنا انه في كتير very outdated يعني very outdated policies. The other issue which I think is very important هو the lack of law enforcement. The lack of law enforcement because of deterioration in the structure of of the system, but also the what I think what Dr. Nouaid talked about, اللي هو in some places the political system which is not allowing a adequate compliance. I think these are the two major factors that are barriers to fighting climate change and air pollution at the same time.
يعني إذا في policies ما في law enforcement.
صح. واحدة غايبة والثانية موجودة أو بالعكس.
Dr. Ahmadi, you have anything to add? عاوز سمعتنا دكتور أحمدي.
I was just unmuting myself.
Okay.
I think in addition to my colleague, Dr. Hassan, what he said is he spoke about policy, but I want to speak about access to data as well. I think we have problem as researchers in having access to data because this data is collected by ministries, and it is very, very difficult because I know, I was involved in 2 reports, for national reports for Bahrain. So I know the problems of facing getting the data, them understanding why you need all this and how the data should be. This is from, research, the data we need is not available. It is not online. It is, we cannot find it. We have to get permission all the time. I don't know about other countries, but in most of the countries, it is like that.
So from EPA.
Yes,
from
yeah.
EPA or EIA.
So, lack of data, outdated data sometimes, or so I know about the policies. And the other problem is engagement of policymakers. Policymakers can be engaged in several ways, but with respect to climate change, I mean, in Arab countries, I haven't seen efforts to bring researchers and policymakers together. Maybe when if they meet together, they can, as a group, they can, policymakers understand our view.
Okay, thank you, Dr. Ahmadi. Dr. Jehan Hassan is not on screen.
Yeah, I am.
Yes, please. The story in Egypt.
I think both Dr. Dahini and Dr. Hamada touched on the most significant points. They leave very little to say, but I would like to say in general, I think the institutional framework needs modification. Both regulatory policy, laws. I think there's also, because of perhaps the absence of data, and in addition to that, there is lack of awareness and education on the issue in general. I think combating climate change, whether through adaptation or mitigation, requires a lot of stakeholders to be on board, to be aware of what's happening, for research to be conducted on the issue in the Arab region. I mean, there's a lot of research globally, and even globally, there are still a lot of challenges that are facing different countries. But I think we need to bring everyone on board. There needs to be transparency, and we need to have clear set plans, both nationally and collaboration regionally, in order to be able to face this. This would include investments in the sector, and particularly with mitigation. I mean, there's a lot of information, particularly published by the World Health Organization, that shows that I mean, even though there might be a large investment at the beginning, but you get this back, particularly when we look at health, and it's worth it. So there's still a lot to be done, I think.
Okay, thank you. في عندي سؤال من مس فادية محمد لدكتور رندا حميدي, asking how humidity is related to climate change and how it is becoming a major factor in Bahrain. Dr. Ahmadi.
Thank you for the question. Well, actually, Bahrain is a very humid country, and we have several months which are quite humid. The study that has been done is an ecological study which have shown that there is an association. And this was done during the third report for the UNFCCC. And we're planning to do publications from the report. But we have found several relationships between humidity and overall mortality, as well as specific diseases. So when one increases, the other one is increasing, which means there has been an when the decline. If there is a decline in humidity over the years, we have been noticing a decline. There was a decline in overall mortality in Bahrain. But it's not only Bahrain that reported it. It has been reported elsewhere. It's in the chapter.
Okay, thank you. I guess we can transfer the mic to you, Najib, if you want to open the general Q&A.
Yeah, I think you could have opened it. You are the master now, but now the coming 30 minutes, as you asked me to talk, because here in the control room, we are monitoring questions coming and trying to compile them. So for this session, we have some questions which were sent to you, and you can select. I hope you have seen them. Have you seen what you received? One.
I can't see them.
You should see them to the right side.
في عندي chat.
Yeah.
Only the chat.
So yeah, in the chat you have some questions, and one of them is for Dr. Rima Habib, if she is still there. If Dr. Habib is still there, tell us when you are there. If you cannot see them,
I go.
yeah.
Still there.
Still there, very good.
Do you want, Najib, do you want to take the questions of this session first? Because we had our share of questions before, and then we can continue.
Then yours will come later.
Yes.
If you cannot see it, Farid, then we shall ask them from here.
Yeah, because I can see this question. كمان يستغرق التعافي الحيوي بمنطقة الانفجار ببيروت.
Okay. This one was for Rima. There is one question specifically for Dr. Hamada.
She answered.
Yeah, and then.
Actually, we cannot see the questions in the Q&A.
Okay.
Can I suggest, Najib, that you ask questions in the control room?
Dr. Habib, if you
ask the questions from the control room.
If you answer the question, if you have seen it.
No, I did not see it. You need to ask the question.
بحسب توقعكم, because you talked about Beirut explosion.
Yes.
بحسب توقعكم ما هو الوقت الذي نحتاجه لمعالجة نتائج انفجار بيروت، للتعافي من انفجار بيروت؟
You want me to answer in Arabic or in English?
In English or in Arabic, and I'll say the question in English. Somebody is asking Dr. Habib, because she talked about the explosion in Beirut, what is the time needed to recover from the consequences, the results of the Beirut explosion? I know, for example, I'll start with the answer. In our office and my home in Beirut, physically we recovered. We kept some things to remind us. let's say, broken curtains, we keep them to remember, but mentally and psychologically, I think it will need much longer time. But not, Dr. Habib.
Thank you, Najib. Thank you for introducing the answer for this question. I totally agree. If you want to start with the cost of the damages, it has been estimated that it needs about $8 billion to recuperate and to rebuild the damages. As you know, hospitals were destroyed, households, streets. It was an enormous destruction, an enormous blast that we are going to talk about the same way that the the Bhopal incident that happened in India in 1984. We kept on talking about it until now. We're still seeing reports on BBC and everywhere on this. So I think that the blast of Beirut is going to be talked about for years and years to come, especially when we unravel the effects of the blast. This is in terms of cost and in terms of impact, as I was showing it in the presentation. Time to recuperate. How can I answer this question? Lebanon lacks the will, I think, to come together as people and as political parties and as government to do something about it, to help the people who are still, some of them living amongst the rubble and the demolitions. So how long it takes? It's the will and the determination of the system, of the government, of the agency. I know that there is agency amongst the people. They have started doing something. They have started working. There are many people that are sometimes establishing alliances and coalitions just to help the people. And we've heard that the army has already enlisted all the damages and the households that have been demolished. And they sent a WhatsApp message to everybody who has been affected. I received it, including me, because my glass was shattered in my home, that you will be compensated for the cost, but you need to keep the receipt. The people could not even afford, with the capital control that we had in the country, the banks were not giving people money to be able to rebuild and recuperate from the damages. So I think this time it's going to be a very, very long time to recuperate, because our political system has collapsed. We don't have a sound political system. We don't have the will and the power to do it. And I think they are only private initiatives that are working currently to help the people. And I'll stop there. Thank you.
Okay. Okay, now we have a question from Magali Mansour. And then it is, were you able to measure the effect of the materials that resulted from the Beirut explosion on the overall health of people in Lebanon? So this is related. So maybe and Rima can answer us.
I'll say a few words and then I'll give the floors to others. No, the health impacts are yet to come. Of course, we had the number of deaths. So we have over 200 deaths, and these are the acute impacts of the explosions. We also had 6,500 injured reported, and these are also another acute impact of the exposure. With regard to the longer term effects, the more chronic, they won't show up instantly, but there are initiatives that will be starting soon to deal with this issue. And of course, the respiratory effect, we can detect them much earlier. such as COPD, asthma, triggers, and all of these things. The longer-term effects from the exposures to the dust, glass, chemicals are going to be a little bit longer term, and we will need to establish perhaps observational studies and longitudinal studies that will allow us to detect those effects. But efforts are underway. Thank you for the question, Magali.
It will be good if Dr. Hassan can have his intervention on this regarding quality of air. It is one of the main effects of the explosion.
Sure. Yeah, I think the direct effects are the casualties, and in reference to what Dr. Habib has said, but still, we still don't have data on the long-term effects. Based on what we know about the material that has exploded, we estimate that there has been a release of toxic gases like NOx and particulate matter, and the particulate matter are of the highest concern because they can suspend in air for a long time. There are also the hazardous material that there are reports about that actually have been evaporated in the explosion, and some of them are unaccounted for. And this is all in the rapid assessment that the World Bank has conducted. And there are also concerns about the asbestos in the silos, the wheat silos, and how it's going to be managed. So there are still issues, and we don't have yet enough data to report on the indirect effects.
I'm
concerned that I would like to raise.
I combine two follow-ups which we received here. Is there any work which started at least to measure the changes in the quality of air on water, blah, blah, blah? I mean, is there any work which started? What can you say as a Faculty of Health Sciences in Beirut, in the city which had the explosion? Do you know of anything which started to measure the impact?
Okay. There are initiatives that have started already, and Khadat Beirut, for instance, that has been recently established as an alliance from AUB faculty and elsewhere, that is led by Dr. Najat Saliba and other faculty members and people from outside AUB. Are trying to establish, and there is the environmental health group, which is led by Dr. Iman Nouaihid, Professor Nouaihid, who are trying to establish, who are trying to collaborate with a French group, some US groups also, in order to make these measurements and assess the impacts on health. So the initiatives have started as a short answer, but it will take a little bit of time to materialize and to establish. Even a cohort study has been thought of to follow up the people who have been affected by this major blast. I can see that the blast is on everybody's mind because it has been really a huge occurrence that has shook the country. Thank you.
Dr. Najib? Dr. Najib?
Yes, listening.
Yeah, can I just tell something, related to, because they might ask other things, but I want to, when we had the oil fires of Kuwait?
Yes.
Yeah, Marhaba Rima.
Hello.
They have done a retrospective cohort study. And yes. And we're teaching this actually so they took all those who were in Kuwait because they are the ones who were living, everybody was exposed. And then they looked into the visits of these people for respiratory illnesses in health centers. And they took those who were in Kuwait previously, right? So because everybody was exposed. But in your case, you have those who were in Beirut, and those who were بالجبل or in another. So you can do something like that. I just couldn't but talk.
Thank you very much, Dr. Randa. Yes, we're thinking about a control group in Tripoli that was far from the explosion. We're thinking about several scenarios that will be possible. We're also thinking about a certain age group below 5 to check how they will develop, perhaps what will be their school performance, their mental health, and etc. over time, going back to schooling. So we are thinking of several options, but we are yet to choose the best option that we can have. Even we're thinking about the registries of the neonatal registry that is available at AUB, and thinking how and looking at how things were before and then after the explosion. So you are right, and hopefully we can consult you at some point in time to tell us if our methodology is sound and give us your feedback. But thank you very much for this observation.
Dr. Najib, may I intervene just for a minute? I think there are initiatives that are being launched. The issue is, I want to go back to the important point raised by Dr. Randa, اللي هو lack of data. Okay. So at the level of air pollution, we have no data at all that relates to the impact on air quality. In my presentation, I talked about the issue of maintaining air quality monitoring networks. Unfortunately, in Lebanon, everyone knows, our network has stopped since July 2019 because it's not being maintained, the air quality monitoring network. And this is one of the issues. The other issue that Dr. Randa, which I second, which she raised, the lack of data, gaps in the data, lack of quality, data of quality, problems in accessing data. These are all important issues that the researchers are facing, and that are barriers to overcoming the problem of the air pollution and climate change and their health impact. And this is the Port of Beirut explosion is actually one illustration.
It seems that we have covered. Yeah.
نجيب في سؤال دكتور باسل يوسف السؤال is about the money.
Dr. Yusuf just had to leave. He informed us he had another meeting with WHO, so he just had to leave.
And I was going to ask if the WHO will participate in the recovery process of Beirut.
I'm sure they will, and I think now they will have more support, as the United States will come back to WHO shortly. So both of you in this session for air quality and for climate change, you will get a boost shortly.
Okay.
Because President-elect Joe Biden announced before he was elected that if he succeeds, his first decision, day one, will be to get back to Paris Climate Agreement. So it is good news for all of us. Now, it seems that the questions which we had for the panel are all covered. We have two persons who asked to speak from the morning. We have Mr. Julien Letellier, in charge of socio-economic affairs of the Barcelona Convention Secretariat of UNEP Mediterranean Action Program. And Mr. Julien, we gave him the screen now, and he has intervention from the Mediterranean Action Program. Julien, are you with us? He can talk now. He is with us, so he should join shortly. Julian, we are not hearing you and we cannot see your frame.
Can you ask him to type?
No, we gave him access, so we can see on our screen that he has access.
Okay.
But he did not show up yet. Okay, we'll move to somebody else who wanted to also give an intervention. I mean, keep Julian when he shows up. Mr. Ammar Al-Musi from Algeria.
Yes.
Ammar, are you there?
Okay.
We gave you
Yes, I'm
access. فيك تحكي عربي كمان إذا بتحب، يا عربي يا إنجليزي. فيك تحط صورتك عطيتك.
ممكن نعطي فرصة للعربية أسبق أيضا. أوكي.
ففينا نعطيك 3 دقائق عرف عن نفسك حتى توفر علينا التعريف وقلنا شو اللي بدك تقوله.
الدكتور عمار موسي عضو برلمان الجزائري وعضو لجنة المالية وعضو دائم في الجمعية البرلمانية للبحر الأبيض المتوسط BRAM. أتكلم اليوم باسم الجمعية البرلمانية للبحر الأبيض المتوسط. الكرام، السلام عليكم. يشرفني ويسعدني أن أنضم إليكم اليوم كممثل الجمعية البرلمانية للبحر الأبيض المتوسط. كما أود أن أشكر المنتدى العربي للبيئة والتنمية على استضافة هذا الحدث. موضوع هذا المنتدى لا سيما في ضوء الوضع الذي خلفته الأزمة مهم جدا، ولقد أظهر
We lost his voice.
يا أمير، يهرمي تتمثل في نمو اقتصادي غير مسؤول يتجاهل الآثار البيئية، فليس فقط غير مستدام ولكنه يضر أيضا بحياة الإنسان. ولقد أظهر الوباء الحالي حقيقة وصفة في هذه، وتقدر منظمة الصحة العالمية أنه في عام 2020 سيموت أكثر من 676 ألف شخص في منطقة الشرق الأوسط وشمال إفريقيا قبل الأوان بسبب التعرض للمخاطر البيئية التقليدية، بما في ذلك تلوث الهواء وعدم الحصول على المياه النظيفة والتعرض للنفايات والمواد الكيميائية الضارة كما سبق وذكر الزملاء. إضافة إلى ذلك، أثبتت الأدلة العلمية أن المناطق ذات التركيز العالي للجسيمات الدقيقة المنبعثة من احتراق الوقود الأحفوري as NOx and SOx كما ذكر الزملاء سابقا ستكون أكثر عرضة وفتكا لفيروس كوفيد-19. الزملاء الكرام، هذه الأرقام تتحدث عن نفسها. اليوم تعتبر معالجة الآثار الصحية السلبية المرتبطة بالإدارة المتهورة للموارد الطبيعية ذات أهمية قصوى خاصة في بلداننا العربية، ويتطلب تعزيز الصحة والازدهار في منطقتنا التزاما قويا من صانع سياسة التنمية المستدامة وأهداف خطة الأمم المتحدة لعام 2030. وقد يوفر هذا التباطؤ الاقتصادي الناجم عن الوباء لحكوماتنا فرصة غير متوقعة لإعادة التفكير في كيفية مواجهة تحديات الصحة والبيئة والنمو الاقتصادي. تفشل التدابير التي تركز حصريا على التخفيف من الآثار الاقتصادية والصحية لكوفيد-19. ستفشل في دفع التغييرات المنهجية المطلوبة لأن التدابير يجب أن تكون شاملة. يجب على البرلمانيين والوزارات أو الوزراء في جميع أنحاء المنطقة العربية توسيع قدراتهم لتحسين الوصول إلى خدمات الصحة والصرف الصحي مع تعزيز السياسات التي تسهل الانتقال نحو نماذج التنمية الخضراء والمستدامة. من هذه الجهود تعمل الجمعية البرلمانية بشكل مستمر مع صانع السياسات من دول البحر الأبيض المتوسط والخليج من خلال تطبيق منهج ذو اتجاهين اثنين. أولا، تتعاون الجمعية مع منظمة الصحة العالمية البرلمانيين على الاطلاع بأحدث المعلومات المتعلقة بتطوير الوباء واللقاحات، كما تسهل الجمعية البرلمانية بناء القدرات في أنظمة الرعاية الصحية، وتشجع الدول الأعضاء للانضمام إلى برنامج كوفاكس، والذي سيضمن الوصول العادل والمنصف إلى لقاحات كوفيد-19. من ناحية أخرى، تلتزم الجمعية البرلمانية بالدعوة لتطوير الأنظمة الاقتصادية التي تعطي الأولوية للاستخدام المسؤول للموارد البيئية. ولهذه الجهود نعمل في مؤتمرنا هذا على تعزيز الإصلاحات التشريعية لصالح الشركات منخفضة الكربون والأنظمة الإنتاجية المستدامة في منطقة البحر الأبيض المتوسط والخليج. على ذلك، بشراكة مع اتفاقية الأمم المتحدة الإطار بشأن تغير المناخ، تدعم الجمعية البرلمانية الدول الأعضاء في تقديم مساهماتها المحددة وطنيا على النحو المنصوص عليه في المادة 4 من اتفاقية باريس. سيداتي وسادتي، في العقود القادمة ستصبح قضايا الصحة والبيئة أكثر تشابكا، وستكون الإدارة والتسيير المسؤول للموارد أكثر ضرورة، وسيتعين إعطاء الأولوية للسياسات الاقتصادية التي تزيد من الاستدامة. لا يمكننا أن نفقد الفرصة الحالية لإعادة تشكيل مسار تنميتنا. إذا أردنا بناء مجتمع قادر على الصمود، يجب أن تصبح صحة الناس والبيئة الركيزة الأساسية لمشاريعنا لما بعد جائحة كوفيد-19. وشكرا جزيلا على حسن الإصغاء، وشكرا جزيلا لكل المتدخلين الذين أفادونا في هذه الصبيحة في هذه الندوة الشيقة، وبارك الله فيكم. السلام عليكم.
شكرا. بالفعل بدي شير انه في مشاركين متعددين من الجمعية البرلمانية للبحر المتوسط، خاصة من دول المغاربية العربية، وهذا شيء مشجع انه البرلمانيين العرب عم يهتموا بهالموضوع. I say it in English for Julian who joined us now. I already introduced you, Julian, you were not there. So I was saying that the speaker we had talking Arabic is Dr. Ammar Moussi, member of the Algerian parliament and of the Parliamentary Assembly of the Mediterranean. So he joins you in the Mediterranean. Now again to Julian, he will have 3 minutes to talk about their view at the Mediterranean Action Plan of UNEP, the Barcelona Convention. Julian would have liked to see you in Beirut again, but just it is good that we can meet like this. Let's make sure that we hear you when you talk.
Okay. Do you hear me, Dr. Najib, now? Oh, perfect. So thank you very much. Thank you very much for inviting us to this launch event and very interesting discussion. I want first to express my strong solidarity with Lebanese people and with Beirut in those very difficult times. I am speaking on behalf of the United Nations Environment Programme Mediterranean Action Plan, UNEP-MAP. In a few words, the UNEP-MAP Barcelona Convention system is a UN treaty, a regional multilateral environment agreement signed more than 4 decades ago by the coastal state of the Mediterranean and the European Union. Our goal is to protect the marine and coastal environment of the Mediterranean as a contribution to the sustainable development of the entire Mediterranean region. And we are very pleased to count AFED as an official member of the Mediterranean Commission on Sustainable Development, which is the multi-stakeholder advisory body of the parties to the Barcelona Convention, gathering not only government representatives, but also stakeholders from various categories, including parliamentarians. And we are also very proud to count the Parliamentary Assembly of the Mediterranean as UNEP partners and MCSD members. I am pleased to inform you that the English version of the State of the Environment and Development in the Mediterranean full report is now available online. The summary for decision maker and key messages publication are also available in English and French as UNEP publication. I will share with you the website to find those publications. Let me mention that the preparation of the SOED was developed over 2 years with contributions from more than 100 authors coming from all Mediterranean countries. SOED covers a wide scope of issues from demographic trends and human development to biodiversity decline, pollution, and climate change. It also includes, for the first time, a full chapter on the links between human health and environmental degradation. Just a figure, 15% of deaths in the Mediterranean are attributable to preventable environmental factors. The sea is polluted by an estimated 730 tons of plastic waste every day, and the region is warming 20% faster than the global average. Although its preparation ended before the COVID-19 pandemic struck, SOED provides insights that are valid for informed policymaking in a post-COVID setting as a wake-up call. We aim at a green renaissance to lift the entire region, not just from the economic contraction caused by the pandemic, but also from the triple crisis of pollution, nature loss, and climate change. SOED provides the knowledge needed so that decision makers can take the right choices to enact the required changes. This is possible with strong political leadership and the participation of all stakeholders, including the private sectors, financial institutions, local authorities, civil society organizations, and informed citizens. The windows of opportunity is still open, and multilateralism and solidarity must prevail. Thank you very much.
Well, Julian, now we still have. Oh, good. Now we can see you, Mr. Musi. شايفينك حاليا. كان لازم تحط الصورة من البداية. مش عم نسمعك. حاليا فيها نسمعك. إيه يبدو إنه الكونكشن مش جيدة، فالدكتور عمار قادر يحط يا صورة يا صوت. حسب تجربتي أنا لما نعمل اجتماعات يونب خاصة من دون صورة الناس بتنعس، أفضل يكون في صورة. I was saying, Julian, that out of our experience, when you have group meetings like this online without an image, people get bored. And most of unit meetings in which I participate don't have images. So you don't know what the one facing you is doing.
ممكن تسمعني الآن؟
Yeah, no, it's هلا جيد. دكتور موسي حاليا شايفين صورته وصوته جيد. هلا أهلا. I just say, do you still have anything to say in this session, or we can close our day?
Is it for me?
عم بقدر اسمعك بس صورتك راحت رجعت.
مشكلة ما أدري يعني سيستم يعني.
نشكر مشاركتك جدا. والزملاء
هو العمل سي نجيب، هو العمل على مستوى البرلمانات من أجل موائمة التشريعات المحلية مع القوانين الدولية، يعني خاصة فيما يخص تشريعات حماية البيئة. هذا العمل يعني نعمل عليه يعني على مستوى الفام، يعني بالتنسيق مع برلمانات ومنطقة المينا كذلك. وطبعا مشروع يعني كوفاكس مهم جدا كذلك حتى يسمح للجميع الوصول آمن وللجميع يعني بأبسط الأسعار وأرخص الأسعار للجميع إن شاء الله. شكرا سيد نجيب.
أنا بدي أعلق أول شيء تعليق صغير بالعربي حتى يوصل للدكتور موسي، هو أنه نحن كثير كنا مسؤولين أنه برلمانيين يشاركوا بهالاجتماع، لأن مهما تكلمنا بالنتيجة التغيير بصير من خلال القوانين والتشريعات. يعني لن نصل إلى مكان لو تكلمنا 100 سنة من دون قوانين وتشريعات. I'll say this in English also for Julian to understand what we're saying. I say we were very happy that parliamentarians, people from parliaments in the Arab region are participating in our conference, like Dr. Musi, because if we keep talking for 100 years, we won't reach anywhere without having legislation and laws which impose what we are saying. فشكرا جزيلا على مشاركتك، وبيكون لنا اتصال بالمستقبل أكيد. بفتكر إنه يومنا انتهى بسلام من أماكن متعددة من العالم كان معنا. ما عندنا أشياء إضافية بالفعل، ففيكم تراجعوا كل الجلسات على أونلاين، كلها تم تسجيلها. نحن اليوم انتهينا. غدا صباحا بنبلش الساعة 9 كمان بتوقيت بيروت، وغدا عنا جلستين بالفعل. الجلسة الثالثة وهي الأولى غدا رح تكون عن المياه والبحار، رح يديرها الدكتور وليد زباري من البحرين. والجلسة الرابعة يعني الثانية بكرة رح تكون عن الويست مانجمنت اند هيلث، يعني إدارة النفايات الصلبة وعلاقتها بالصحة. Saying it in English again, that tomorrow we start at 9 Beirut time. We have 2 sessions. One session is on water and marine environment and their impact on health. And the 4th session, which is the second one of tomorrow, will be on waste management, solid waste management and health. In that session also, we shall be having as guest speaker Dr. Leila Iskandar, who is very active in Egypt. She was Minister of Environment, and she was the one behind what you all know about Hayy Zabbalin neighborhood in Cairo, where she tried to involve local community in solid waste management. So tomorrow then we start at 9 Beirut time, 8 your time, Julian, I think, and 10 time of the Gulf countries and many other Arab countries, but it is earlier in the Maghreb countries, so even earlier than Europe. So for Dr. Ammar and others in Morocco and Tunisia and Algeria, they will have to wake up earlier than us in Beirut even to join. Thanks a lot. شكرا جزيلا.
There is a message from Saeed Zarkali on the chat. أطلب التدخل إن كان ممكنا. I'm reading it right now.
قلنا له لسعيد بكرة غدا.
Okay.
جاوبنا إنه غدا. يلا شكرا جزيلا. تحيات.